Hey everyone, my name is Bree, and I'm going to talk about being a medical scribe and how it prepared me for PA school, which I began in January, and how it was a great experience for me and how I learned from it. To me, a medical scribe is someone that does documentation for providers. And so for me, when I would go into the room with the doctor, he would be talking to the patient, asking what the symptoms are, and I'm typing everything down. And so I'm typing down the HPI, which is subjective information, and then I am doing the physical exam findings, I'm doing the medical decision making, and then I'm also ordering labs and imaging and whatever needs to be ordered. So I became a medical scribe by applying through a company called Scribe America. If you Google Scribe America or go to scribeamerica.com, you can find out more about them, their locations, and the type of settings that they have you work in. So I applied during my senior year of college, during my winter quarter, and I got hired and they placed me in urgent care. So when I was hired, they did classroom training for me. So I believe it was 6 weeks of training where I would go into a classroom, I'd learn about medical terminology, certain symptoms and diagnoses and medications. And they kind of set you up a lot for the area that you'll be working in. And so, since I was in peds as well, we learned a lot about children and findings in children. And so, after I did my classroom training, I got put on the floor and I followed a medical scribe for about a week. And then I was all alone and I scribed by myself. And so the urgent care was great because I got to work with a ton of different providers. I worked with NPs, I worked with PAs, I worked with MDs. And so I got to see how different providers do their charting differently and also just how they think. And I got to pick their brains a little bit, which was really cool for me. It was also great because peds and little kids is super cute. And so it was a fast paced environment with super cute patients. And so it was very fitting for me. And then when I graduated college, I needed a full time job. And sorry. So I needed a full time job. And from there, I went and applied for a hospital, which placed me in primary care. So I could only apply to the hospital because I had experience because they don't do on the job training. And so I started working in primary care. And that was really great because I worked with one provider who was an MD. And I got to learn a lot about him and build a really good relationship with him. And then also got to build a relationship with with patients. And so urgent care patients come and go, but in primary care patients come routinely for physicals, or if they have any problem, they have to go through their PCP. So that was really great. And I also learned a ton from being a medical scribe. So what did I learn as from being a medical scribe? Well, I learned how to use an electronic medical record, which is really important now because that's how it's shifting for charting so that everyone can be well connected no matter where you are. So I learned how to do that. I learned how to document. And then I also learned a lot medically. So through just redundancy, I learned what certain symptoms mean for treatments and diagnoses, what medications we will want to prescribe them, and then what labs we'll want to order. And so I started being able to say, oh, this person has a cough, so we want to get a chest x-ray to rule out pneumonia, and then we want to order antibiotics, so on and so forth. And so that was a great learning experience, and I think I've learned so much more than I ever thought I would. Scribing is so invaluable. And I've also learned how to interpret EKGs, which is really cool. So I've gotten pretty confident in those. My doctor would give me the EKG to interpret, and I would do my interpretation, and then I'd hand it back to him, and he would say, oh, this is right, oh, you missed this, and teach me from there. I also learned how to interpret bone density scans, which was great. And then I also learned how to interpret labs. So if he found an abnormal lab finding, he would teach me what it means, what further testing we would want to do from there, and what type of specialty we'll want to refer them to. So I've learned a tremendous amount from scribing, and I feel like it's prepared me so much. And I get to see the everyday life of a provider as well. So I'm kind of getting to know what I'm going into in the medical field. What are the pros and cons of scribing? Cons, I don't really see a ton. Maybe being behind the computer a lot, but it's something that you're going to have to do with being on medical records. But pros, like I said before, you just learn so much, and it prepares you for either medical school, nursing school, or PA school. So there's really no bad things to it. It teaches you so much. The typical pay of a medical scribe varies. I mean, it's from place to place, how much experience you have, state's minimum wage. And so I'd really just do your research if you're curious on the pay, talk to someone, see what other medical scribes make. And I can tell you it's not a significant amount, but I lived on my own and it did get me by. Now, how does scribing apply to PA school for me? So, scribing was a form of patient care hours for me. But on CASPA, unfortunately, scribing was to be put under healthcare hours. But I just emphasized that I was a scribe and how I utilized patients in that and how I was hands on with patients. And so I try to make that clear when I apply to schools. But I scribed for about a year and a half, and I have 2,500 hours when I applied. And so they say that scribing or just working in general for 40 hours per week for a full year will be around equivalent to 2,000 hours. So do your research on what PA schools you want to apply to, what they accept for their patient care experience, and then how many hours they need. So you can definitely choose what field you want to go into and what school you want to apply to based off of that. I frequently get asked if you have to have a biology degree in order to be a scribe. I don't clearly know. I know you don't have to have a college degree because I worked in college. I know you need to have a high school diploma. I think they are looking for people that want to go into the medical field and have a drive to be in the medical field, because then when you're working as a scribe, you're happy to be there and you're learning a lot. And so I think that's an incentive. I'm not sure if you just want to work as a scribe, if they'll just let you. It doesn't hurt to apply at all. Go take your chances and talk to someone. And if you're really curious, email a company and see what they say. Is scribing part-time or full-time? It's actually both. And so when I worked in urgent care during college, it was actually a part-time position. And it was really great because my hours were at night, and so I could go to classes and then go to work after. And then when I graduated, I took a full-time position in the primary care. And so it was a really great balance for me, and I really enjoyed it. So definitely look into the companies you want to work for and see if they are part-time or full-time. Do your research. First off, sorry my screen's getting darker. It's getting darker outside, so it's making the room darker. But I wanted to touch on being behind the computer a lot. So you are behind the computer most of your day because you are documenting for the provider. So I highly, highly recommend getting glasses, whether they're prescription or not, and get the type of lens that will block out the blue rays and so they don't affect your eyes. They were so beneficial for me. I got headaches in the beginning, and then once I started wearing my glasses for work, my headaches started resolving. So I highly recommend, if you're going to be a scribe, get glasses, whether they're prescription or not. I want to thank you all for tuning in today and watching my video. Go follow me on Instagram at lifewithme_PABree, and go check out my blog at lifewithmepabrie.blogspot.com. I hope you all have a good day.